to another episode of Ask a Doc here at HCA Florida, North Florida Hospital. I'm your host, Lauren Letillier. I'm the Director of Communications and Community Engagement here at HCA Florida, North Florida Hospital here in Gainesville. And we have a very, very special edition of Ask a Doc today. It's about pancreatic cancer because November is Pancreatic Cancer Awareness Month. And we have some very special guests. We have Dr. Yassine Pertani and we have Dr. Tony Brar here. They are advanced gastroenterologists here, affiliated with HCA Florida, North Florida Hospital. Welcome, you guys. Thanks for joining us.
Well, thanks for asking us to come on.
Yeah, thank you
a
for
pleasure.
having us. Thank you.
Absolutely. So before we get started, we're going to do a little bit of our pleasantries. We just want to make sure everybody can hear us today. So go ahead and let us know in the comments how we sound. Also, go ahead and submit your questions at any time. You have these two guys for the next 20 to 30 minutes. So go ahead and submit your questions at any point of this broadcast. I will be watching them here on my iPhone, on our live feed. And just to make sure we're looking good. Are we looking good, everybody? Perfect. Awesome. All right, so let's go ahead and get started. Welcome, everybody. Thanks so much for joining us. Want to get a little bit of an introduction into our physicians today. So if you could just take a minute to tell us a little bit about yourself so we can get to know you better.
Sure. So my name is Yassine Pertani, originally from Miami, Florida. I did my medical school training in Fort Lauderdale, Nova Southeastern University. Following that, all of my post-medical school training was at the University of Florida, where I did internal medicine residency training, GI fellowship, and another fellowship called interventional endoscopy or advanced endoscopy. I've been affiliated with HCA and part of Digestive Disease Associates for almost 3 years now, and it's been a great time while I've been here.
Awesome.
Right, yeah. And my name's Tony Brar. I'm from Tampa originally, Tampa, Florida, and I did my undergraduate training over at University of South Florida in Tampa. Went to Florida State University for medical school, and then also similar to Yassine, I did my internal medicine residency and gastroenterology fellowship training at the University of Florida here in Gainesville. And then I also did the kind of additional year of training for advanced therapeutic endoscopy, like Yassine, except I did it over in Orlando with the Center for Interventional Endoscopy in Orlando with Advent Health, and then decided to come back and now have been with Digestive Disease Associates and HCA now for about a little over a year, and really happy to be here and help out and discuss a very important topic.
Well, I have to say that these two physicians have really brought a lot to our complex GI program. They are doing some procedures that we have never done here at our facility. So we're so thankful that you both are here and serving our community.
Thank you.
Today we're talking about pancreatic cancer, and I wanted to kind of start off by asking you both, what is a GI physician's role in the treatment of pancreatic cancer?
Yeah, no, that's a good question. So a lot of these times when with pancreatic cancer, the diagnosis and staging is very important. And so that's where our role is really kind of important and gets utilized. So we do things with our endoscopy, which is, a small tube where we go and do a procedure, a non-invasive sort of procedure where we are basically able to examine the pancreas. We use the ultrasound technology, get a good look, and we can kind of look for any sort of what we call lumps or bumps or lesions or masses, and we're able to actually biopsy and sample these things and send them off to our pathologist to kind of get a good tissue sampling to get a good diagnosis of exactly what we're dealing with. And then in addition to that, we can kind of help kind of stage cancers as well, where we can look at if there's any sort of spread, to any other lymph nodes or any other organs such as the liver, and get a good kind of overall picture for things to help our surgeons and our oncologists and also our pathologists with coming up with the treatment and the stage to guide management going forward. And then kind of in addition to that, too, down the line with regards to specifically pancreatic cancer, we're able to sometimes treat if the cancer itself causes troubles for patients, such as if it blocks your bile duct, which is kind of the pipes that drain your liver and gallbladder. The pancreas kind of sits in that area, so if there's a mass blocking it, we can help kind of relieve that by putting a stent in and relieving the blockage. Also, this can cause pain for a lot of people, and we can do different kind of nerve blocks endoscopically to help treat the pain as well. And then even if it causes, we talked about blockages of the bile duct, we can also treat if it causes blockages of the small intestines or stomach, where people can't tolerate food or things they're eating. We can also do procedures endoscopically to allow bypass or detour of these blockages, so people can eat and kind of tolerate, food and hopefully get some sort of relief from the cancer that's causing issues for them.
That's fantastic. So talk to us about, for those who may not know, or maybe for those who have just been diagnosed and are looking for a resource. Let's go ahead and start at the beginning. What is pancreatic cancer and what is your pancreas?
So your pancreas is an organ that sits behind your stomach, and it has a couple of major functions. The first function is to secrete enzymes that helps you digest your food. And the second function is to secrete hormones that regulate your blood sugar, things like insulin and glucagon.
Okay. And so why is learning about this topic so important? I can think of so many reasons, because I have heard that it's just kind of a silent disease. There's not a whole lot of symptoms. So can you talk about why it's important?
Yeah, I mean, pancreatic cancer is the third leading cause of cancer mortality in the U.S. and soon to be the second leading cause by 2030. You have a lifetime incidence of developing pancreatic cancer, about 1.5% throughout your lifetime. And the 5-year survival of pancreatic cancer once being diagnosed is very low. It's only around 10 to 12%.
Wow. Why is it so deadly?
I think it's, first off, most of the time when we find out that a patient has pancreatic cancer, it's already advanced. There's really a lack of effective early detection approaches for pancreatic cancer, and surgery does offer potential cure, but only 20% of patients who present with pancreatic cancer are surgical candidates.
Wow. What are the types of pancreatic cancer that you guys treat?
Yeah, sure, I can kind of chime in here. So typically, there's two kind of major classes of different pancreatic cancers. One's kind of what we call the exocrine, which is the cells that kind of secrete enzymes, and then there's also endocrine, the cells that kind of secrete some of the hormones. But majority of the cancers that are typically diagnosed and found are of the exocrine type, which is the adenocarcinoma, and some of the other ones are less common, but neuroendocrine is some of the other ones we see. But those are kind of the common ones we see, and just kind of chiming in with what Yassine was saying. With regards to pancreatic cancer and how it continues to grow in its occurrence and frequency, and like he said, just kind of re-emphasizing the importance of assessing things or with your physician when you have issues and getting them checked out early is always really important. So that way we hopefully prevent anything that may have been caught early and, like you mentioned, maybe curative as well.
Absolutely. Well, if you guys just joined us, we are here for Ask a Doc, and we're talking about pancreatic cancer for Pancreatic Cancer Awareness Month, which is the month of November. We have Dr. Brar and Dr. Bertani here. They are advanced gastroenterologists affiliated with HCA Florida North Florida Hospital. We hope that you will submit your questions for them. They're going to be taking your questions here really shortly, so go ahead and submit your questions in the feed, and we will go ahead and ask the docs here live on Ask a Doc. So to continue with our conversation, how does pancreatic cancer develop?
So, really on a cellular level, there's a series of genetic mutations and chromosomal abnormalities that occur in the pancreas, and this leads to an eventual tumor that can eventually turn into pancreatic cancer. Approximately 10% of the time, these are genetic mutations that patients that are inherited by their parents, and 90% of the time these are sporadic mutations.
Wow. What are the risk factors for pancreatic cancer?
Yeah, I think one of the most common ones is tobacco use, in addition to alcohol, diabetes, obesity, if someone's had a known history of pancreatitis or inflammation of the pancreas, and definitely a family history predisposes people as well.
Are there any symptoms? And we were talking about this earlier, right? That's
Right.
the kind of scary part of this. What are the symptoms of pancreatic cancer?
So usually when pancreatic cancer is starting to develop, there are no real big symptoms. Patients are mostly asymptomatic. But as it starts to progress, you start seeing things like unintentional weight loss, dark urine or pale stools, jaundice, which is yellowing of the eyes or the skin. You can get pancreatitis out of nowhere, and you don't see an obvious cause based on your labs or your imaging studies, or new onset diabetes.
Okay. what are the how do you diagnose this? So once a patient presents to you, what are you guys looking for in your diagnosis?
Yeah, sure, I can take that one. So sometimes some of the common things, I mean, there's different blood tests. I mean, you can look at things like your liver function tests, as well as there's certain tumor markers. Those themselves aren't always 100% reliable, and the bigger one that we use more commonly and find is with imaging testing, like a CAT scan or an MRI, and later on like a PET scan for staging. And then, like I mentioned at the kind of start of our talk, with what we do as gastroenterologists and endoscopists is different kind of scoping tests where we do a procedure and we can get an ultrasound endoscopically to look at things. And also the biopsy is kind of the key diagnostic marker to get a tissue sample of the mass or the lesion where we can analyze it under a microscope with our pathologists, and that gives us the true diagnosis. And then from that as well, we can send different kind of genetic testing as well in family history, or if it's prevalent in a person's family.
Okay. Well, if you guys are just joining us, this is Ask a Doc in honor of Pancreatic Cancer Awareness Month, and we are talking about that topic today. We have Drs. Brar and Pratani here, and they are going to be taking your questions here really shortly, so make sure you go ahead and submit those in the live feed of this video. I'm watching for your questions right now, everybody, so go ahead and submit your questions, and we'll be taking those here in just a few minutes. So, doctors, how do you treat pancreatic cancer? There must be a bunch of different treatments for this type of disease.
Yes, there is, and because of that, there's multiple doctors involved. It really takes a multidisciplinary team, and this includes us, the GI doctors, the surgeon, the surgical oncologist. We have a great one here named Dr. Macedo. He really is a big leader in this field. We have our radiation oncologists, our medical oncologists, the pathologists, social workers, nurses. Everybody has a big role in patients who are newly diagnosed with pancreatic cancer. Traditionally, we like to do surgery in a lot of our patients who present with pancreatic cancer, but going back to only about 20% who present are surgical candidates. So then we get down to additional treatments, which include chemotherapy, you have immunotherapy, you have radiation therapy, and there's tons of new clinical trials that are available here for our patients who, will help survival.
Oh, that's fantastic. So let's talk about this topic of pancreatic cysts related to pancreatic cancer. How is that related?
Yeah, sure. So, so pancreatic cysts are actually one of the most common kind of what we call incidental findings on imaging scans done on patients. So sometimes people, get a scan for abdominal pain or other reason that they're having, and the CAT scan will show something on the pancreas, usually like a cystic lesion, or maybe it's like fluid filled or something like that. Now, the reason why this is important is because they're very common, and they do need some sort of follow-up or what we call surveillance to keep an eye on, because they're sometimes a progression of these cysts to progress to something like the cancer that we've been talking about.
Wow.
And so these incidence of these cysts is increasing, I think, with all the scans people are getting and all the increasing rise of cancer like we talked about. And so typically, though, to kind of manage these things is we do different CAT scans and MRIs of these cysts every so often to keep an eye on them to make sure they're not growing or changing in size. And then, like I mentioned before, we can do a endoscopy with the ultrasound kind of imaging to help further evaluate the pancreas and the cyst and even sample them for fluid analysis. And then again, going back to the kind of curative treatments, if it is something that's cancerous or precancerous, we can consider surgery or other sorts of therapies to help treat these lesions that we find.
And to go off what Dr. Brar was saying, not all pancreatic cysts are cancerous. So it's our job as GI physicians to delineate which ones are the non-cancerous type, which will never turn into cancer, versus which ones are the precancerous type. And we do that several ways. We do that with a thorough clinical history. We do that with cross-sectional imaging, and we do that with endoscopic ultrasound sampling.
Wow, that's fantastic. So often with cancer, we talk about screening, right? What are the screening options or recommendations that you may have for those who just out there watching for pancreatic cancer?
Sure. So for the general population, At this point, there is no generalized screening recommendations like there is for colon cancer, but there are screening recommendations for patients who harbor a higher risk of getting pancreatic cancer in their lifetime. These are patients with certain genetic mutations or a significant family history of pancreatic cancer. These, some of these syndromes are called Peutz-Jeghers, Lynch syndrome, patients with hereditary breast and ovarian cancer syndrome, familial malignant melanoma syndrome, and familial pancreatitis. Now, the lifetime risk in these patients of developing pancreatic cancer can be as high as 30%. And that's why we start screening these individuals as young as the age of 30, because we know that they have such a high risk of developing pancreatic cancer. Now, how do we screen for these patients? Or what do we do? There's several things we can do. Most commonly, we do MRIs of the pancreas, and we do, again, endoscopic ultrasounds of the pancreas.
Fantastic. So before we're almost to questions, guys. If you have any questions for Dr. Brar or Dr. Bertani, they don't have to be about pancreatic cancer. They do a lot of things, but if you have any questions for them, go ahead and ask them here live on Ask a Doc. We're about to take your questions here in just a few minutes. And so to kind of wrap up today, I'd love to learn from you both. What is the future for pancreatic cancer treatment and diagnosis? Can you talk about that?
Yeah, sure.
Sure. I mean, I think what we touched upon prior is that a lot of our patients are being diagnosed at such a late stage. So a lot of the research currently is being focused on early detection. So this has been done in several ways. For instance, we're using, soon to be using artificial intelligence, using that technology in our CTs and MRIs, looking for signs of occult or small tumors that may otherwise be missed by radiologists. They're developing microbiome signatures in patients who have early pancreatic cancer. Not there yet, but these are some of the things that are being developed. And lastly, in terms of what we're doing as endoscopists, we have something called next generation sequencing that's going to be coming available to us shortly, looking at early lesions in the pancreas or pancreatic cyst, and looking at genetic variations inside the cyst fluid or pancreatic tissue fluid to tell us whether these patients would be high risk of developing pancreatic cancer in the future, or these patients we don't have to worry about. And not only that, those are in terms of diagnosis. In terms of treatments, there are even radioablation therapies endoscopically given for patients with certain types of pancreatic cancer and high-risk pancreatic cysts that are being developed.
Fantastic. Well, I think we're ready for questions, guys. So if you have any questions for Drs. Brar and Pertani, they are here to answer all of your questions that you may have about pancreatic cancer in honor of November being Pancreatic Cancer Awareness Month. I do see one question that's come in, guys, and so this one's a very unique one. You talked about earlier that there is chronic pancreatitis is the risk factor. Can you talk about what is pancreatitis?
Yeah, sure. So pancreatitis is kind of a clinical sort of diagnosis where people may present with significant abdominal pain, what we call an epigastric, kind of central abdominal area. And then there's also kind of a blood test, something called the lipase, which kind of is a marker of the activity of the pancreas. That's usually increased as well. And then the big one is cross-sectional imaging with a CT scan or something that shows the pancreas itself is basically very angry and inflamed. Okay, and now with pancreatitis, there's different types, like we talked about, with acute and then chronic. So this can happen sometimes and could be caused from gallstones, stones in the gallbladder causing issues. It could be caused from alcohol or tobacco use, and then sometimes people have it, and then it's one and done, so to speak. Other people may get what we call recurrent pancreatitis, where it keeps coming back. So when that happens, that can eventually lead to something called chronic pancreatitis, where the pancreas gets really scarred down, fibrotic, and has its own set of kind of complications and issues to deal with. And so the real big important thing when kind of having these issues or being diagnosed with these things is, one, why, the cause, what caused this, and to try and prevent it from recurring. And then two, also making sure that it does not progress. in addition to the immediate treatment to help control the pain and inflammation that may arise from these issues.
Fantastic. So, but what does that feel like for a patient to have pancreatitis? You know?
Yeah, a little bit of what Dr. Barr was saying was patients feel like they have severe upper abdominal pain. Sometimes that shoots towards the back.
Okay.
They can have really bad nausea, vomiting, and sometimes they can even have weight loss because as soon as they start eating, they're getting severe pain.
Wow. Well, thank you for your question. That's fantastic. Thank you, guys. If you have any other questions for Dr. Bertani and Dr. Brar, now's the time. They are taking your questions about pancreatic cancer. And so I see another question here, guys. So this question says, Dr. Brar, Dr. Bertani, I have pancreatic cancer in my family. Would you recommend genetic testing for me? What do you think?
I think it's reasonable. I think if you have pancreatic cancer in your family, depending on if it's a primary relative or a secondary relative, or how many family members you have that have pancreatic cancer in your family, I think it's very reasonable to undergo genetic testing, which we offer here as well.
Yeah, I agree with that. I think it goes back to what we've kind of been saying. It's always important, since more and more data and research is going into detecting this early. If you know that your family has a history of it, or you know you have some symptoms, it's always good to come get checked out, evaluated, and we can kind of work together, like Dr. Bertani mentioned, to see what sort of testing can be done, what sort of treatment options there are, and to kind of give you hopefully a disease risk assessment to see where you stand, and hopefully give you either relief or also give you options of what can be done and needs to be done.
Right, because 10% of patients who have pancreatic cancer are due to inherited genetic mutations. So if we can identify that early in patients, we can essentially map out a surveillance regimen for them to make sure they don't develop any tumors in the pancreas with either MRIs or CTs or endoscopic ultrasound. So if it does develop, we're able to catch it fast and treat it.
Fantastic. Thank you, guys. Appreciate it. Thank you for your questions. If you guys have any more questions, this is the last call for questions, so go ahead and get them in, folks. Last call for questions for Dr. Brar and Dr. Bertani. They are advanced gastroenterologists here at UC Florida North Florida Hospital, and they are here talking about Pancreatic Cancer Awareness Month. So I have another question that's come in. Doctors, what would you recommend is a good place for me to start? They said after watching this talk today, they're they want to get checked out. So where should they start?
Yeah, that's always a good question. I think the most important thing is kind of starting with, your primary care physician, getting plugged in, making sure you have a good kind of preventative health assessment of everything. And then, there's always, if there's any concerns, whether it's any sort of GI symptoms, lab work abnormalities, imaging abnormalities with CAT scans, MRIs, to get referred, to a gastroenterologist. And like we mentioned, we're always happy to see these patients, early. Obviously, we see a lot of this late too, but and everything in between, because there's always options and always things to discuss. And if we work very closely with our team here, so there's a lot of multidisciplinary approach in managing these symptoms. So I think getting plugged in and checked out, and we're always happy to kind of assess things and provide care in any way we can.
Awesome.
Yeah, 100% agree. Start with your primary care doctor, or if you don't have one and you want to call us directly, then I would encourage that.
Fantastic. Well, thank you for your question. That's fantastic. We have another question. Last call for questions, everybody. If you have any questions, go ahead and type them in now. So this is a great question. Dr. Brar, Dr. Bertani, I am a pancreatic cancer survivor. How do you support your survivors in their survivorship?
Yeah, well, first of all, congratulations. I think that's great. That's remarkable. And we're glad to hear success stories, because those are always really make all of us feel, rewarded and humbled for what we get to do. I think the big thing is, like we talked about, is continuing to kind of follow up with your healthcare providers and your gastroenterologist, because it's good, that you're doing well, survived it, but keeping an eye on things, making sure there's no recurrence, making sure you're up to date on your staging, your screening, your surveillance. And then if you have any symptoms of other things, because, if you develop any new issues with the pancreas or any other GI issues, we're always, happy to evaluate and discuss. And last thing we want to do is just say, hey, you're good, and don't need to come back ever again. It's more kind of a preventative, active, engaged approach. And, once again, congratulations. That's awesome. And we're very happy to hear stories like that.
Yeah, I 100% agree. Congratulations. One thing to keep in mind is that more than 50% of patients who undergo Whipple procedures for curative intent for pancreatic cancer can develop something called exocrine pancreatic insufficiency. This is when your pancreas, or there's not enough exocrine cells to secrete these enzymes to help you digest food. This can also lead to nutritional deficiencies, unintentional weight loss. So I would definitely make sure you're plugged in with a gastroenterologist who can check for this and treat it at the same time.
Fantastic. All right, looks like that's all the questions that we've received today. Thank you guys so much for tuning in for another episode of Ask a Doc. And before we end and close it out today, I just wanted to turn it to you guys to get both of your kind of impact statements on, why is Pancreatic Cancer Awareness Month important to both of you?
Well, yeah, I think one of the major things is that it is a prevalent cancer. It is one of the highest cancers that have the highest mortality. It's a cancer that we see quite often. And the reason that me and Tony, did an advanced endoscopy fellowship is to treat patients who have this type of cancer and the complications that come with it. So that's one of the things that I feel really passionate about.
Yeah, I kind of echo those statements, and I kind of agree a lot. And I think the thing with pancreatic cancer and this being the awareness month, I think a lot of people, either if they have first-hand experience or relatives or family friends with it, may know a little bit about it. And then otherwise people think that maybe it's very morbid and has a bad prognosis and overall bad mortality. But I think the future is really bright with pancreatic cancer. There's so much research, as Dr. Gurtani talked about, that's being done to hopefully prevent these things from progressing. And in addition, there's a lot of things that we can kind of help with to alleviate any sort of symptoms or issues that arise from it. And like Dr. Gurtani mentioned, we're always looking to help advance the field forward. And a lot of the options we offer are minimally invasive, all endoscopic, non-surgical approaches. So if there's something that we can help out that maybe less invasive, we're always happy and willing to.
And I think that was the message that, because you joined us last year for Pancreatic Cancer Awareness Month, and it just got even more special with Dr. Rattani this year. So I think that was one of the things that really resounded with me, is that you said there still is hope. I think that was your message last year.
Yeah, absolutely. I think never think you're alone. We, even as doctors and physicians, we work as a team, with our nurses, our staff, our techs, our medical assistants, everybody. And I feel like here in Gainesville at HCA and DDA, we have a very good team-centered approach where we all work together and put the patient first. And I think that's really the key in everything we do, because we're here to help out, patients.
Yeah, I agree.
Fantastic. Well, Lori says, thank you, docs. So that's so nice. Thank you, Lori, for tuning in. We really appreciate it.
Thank you.
Thank you both for your time. Really, really appreciate you taking the time out of your busy schedules to do this community education. We really appreciate it. Thank you, guys.
Thanks for having us.
And thank you guys for tuning in for another episode of Ask a Doc. We'll see you next time.